Good morning everyone. So today we will be talking about the next step of complete denture fabrication in the patients, and that is the most important step for our success of complete denture fabrication, right? So the topic is for today is border molding, or which is also commonly known as peripheral sealing, and which is to be done after our special tray for the custom tray for the patient is made, right? So we will be seeing today what exactly is border molding. So as per the definition of border molding, it is the shaping of an impression material by the manipulation of the action of tissues adjacent to the borders of the impression. So what exactly are we doing? We are trying to manipulate the tissues so that our borders are recorded, and also main aim to achieve is the peripheral seal with the procedure of border molding, right? So what we are supposed to do basically is we have to first find out what are the different objectives of border molding. So what could be the objective of border molding? So it will be the determining the contour, height, width of the borders of the complete denture, so that when the patient is wearing the complete denture, the main aim should be the denture is retained in the patient's mouth. So in order to do that, we need to also find out that what exactly are the movements of the patients, what exactly are the manipulation the patient is going to do, what exactly are the mastication movements the patient is supposed to do. So all those particular movements are the ones which we are supposed to record in the step of border molding. So taking forward, we will see what are the materials that we can be using for manipulation of border molding. So we can be using green stick impression compound as very commonly used. We can also use elastomeric impression material, that is polyether, or even putty is the material of choice which we can use. Earlier days there were impression waxes which was used, and also different other silicone impression materials. As I told you, the putty indexed materials was what is allowed to use as a border molding. So now taking it forward, we will also see what are the other requirements for starting of a border molding. So as we all know, when we have to do border molding, what is the first thing that we are supposed to do is first primary impression of the patient is made. From that preliminary impression, we have to conduct or achieve a preliminary cast, right? So from that particular cast, what we are supposed to do, we are supposed to make a spacer designing, we are supposed to make the custom tray on that. Once the spacer designing is made, we have to go for relief waxes. Once the relief wax is given, we have to also make the vent holes, the border molding holes which has to be made, and then finally we have to go for custom tray fabrication. So when we have made with the custom tray, we need to make sure that the borders of the tray is 2 mm lesser than the width or the height of the sulcus of the primary cast that we have achieved, right? So what all the requirements we need to keep in the clinical side when we are proceeding for border molding is the special tray. We need one Bunsen burner, or else we also can have a blowtorch. We can have warm water, cold water, scalpel, glove, mask, syringe. In case of polyether, if we are using, we need to have a syringe for loading the impression tray. Adhesive material in case of polyether as well, because we need a tray adhesive which will get adhere to the special tray or the custom tray that we have fabricated. As we all know, before fabrication of custom tray, we have to undergo certain more procedures, whereas it can be made with a light cure, it can be made with self cure, it can be made with shellacs. There are different materials by which we can also make the custom tray which is used for border molding of the particular patient, right? And the reason that we are doing this border molding or getting a custom tray to avoid the ambiguity that all the patient's mouth intraoral conditions will not be similar, right? So that is the reason that we are making a custom tray which is customized for that particular patient, so that we can, the denture which is coming over as the final product after the entire fabrication of complete denture will be allotted only to that particular patient, which will fit exactly in the patient's intraoral condition, how we need the movements of the patients, how we have recorded recorded, basically the movements of the patients, right? So there are two different techniques of border molding. One is the sectional or incremental border molding technique, and the other one is the totally complete or single step simultaneous border molding technique. When we are talking about incremental border molding technique, that will be done either with green stick impression compound, and when we are talking single step, it is usually done with a polyether or a silicon impression technique. So what is the procedure is what we will go through in details of the procedure. So initially what we told already was that the custom tray should be refined and reduced till 2 mm short of the particular sulcus, all the reflection what we are supposed to do. You have to manipulate the green stick material, that is with the flame you do, or some people will prefer it to do with hot water, because there are some studies which shows that the properties of the green stick will get distorted if we heat it in one particular section with a high temperature, right? So better is we can also do it with hot water, and then the material should be tempered in warm water before we are actually starting the manipulation and placing it in the patient's mouth and starting the manipulation of the functional movements in the patients, right? So how are we doing that? As I told you, the functional movements in the maxilla, we will be speaking about different functional movements that we will be taking care of and about. In maxilla, first is the labial flange. As we can see, the labial flange area. So first we start with the labial flange of the border molding. So once we are doing labial flange, how are we going to do that? So we are going to do outward, downward movement to the lip. That means we are asking the patient, when we have put the border molding tray inside the mouth, then we will do an outward, inward and downward movement of the lip area of the patient, so that we can record the labial sulcus section of the border molding. Coming to the next is the buccal flange area. So what we will ask the patient to do in this, we will ask the patient to pucker the lip and smile. That will exaggerate the borders of the buccal flange area, and the buccal frenum which we have down will be recorded by pulling it outward, downward and little more backward and inward, not just inward, backward and then inward, when we are supposed to record the buccal flange area of the particular patient. Correct? Coming to the distobuccal area, this should be performed bilaterally. Remember, distobuccal is that area which is also the coronoid notch area, where our condyle of the mandible, the condylar process, and then the next comes as the coronoid process. That coronoid will go and hit in that particular area of the denture when we are opening and closing the mouth. Correct? So what is the main glitch about this particular area is when a patient is smiling, opening the mouth or speaking, if this particular section of the freeway space which is given in that particular area is not recorded properly, if it hits the denture will dislodge down, right? So what is our aim is to record it in the functional movement, so that when the patient is also opening the mouth, closing the mouth, this particular section is not getting dislodged because the coronoid notch is hitting that particular area. So basically, how do we record distobuccal area? So to record distobuccal area, you need to remember two things. One is recording the width of the distobuccal area, and to record the height of the distobuccal. So when I am supposed to record the height of the distobuccal, I will ask the patient to open my mouth wide, and if I have to record the width of the distobuccal area, I will ask the patient to move the mandible to the left and right side. So what is happening when we move the mandible to left and right side? It is going and hitting to particular freeway space which is there over there, which will get obliterated when the patient is doing mastication or moving the mandible. So that particular section will be recorded by the functional movement by asking the patient to move the mandible side to side, and also when we ask the patient to open wide, we will record the width of the particular distobuccal area. Coming to posterior part of lateral hamular notch. So while opening wide, we have to press the chin area with the hand. That will take care with our posterior lateral part of the hamular notch. Now coming to the most important thing is vibrating line or the posterior palatal seal. First important or foremost thing that we need to understand is, first we have to find out or locate where our posterior palatal seal area is. So divided into two different sections, the anterior vibrating line and the posterior vibrating line. We will record it accordingly. We will ask the patient to say ah in a short vigorous motion. That will record our anterior vibrating line. And when we ask the patient to say ah in very harsh motion, in very non-vigorous motion, that is, and very heavily, that is the time when we will record the posterior part of the vibrating line. Once we have located the vibrating lines, the next work is to how to record the posterior palatal seal, correct? So once we have located where our anterior vibrating line is, where our denture should be ending, then we will place the green stick in the patient's mouth. We will ask the patient to look down so that the head is 30 degree below, 30 degree to that of your Frankfurt's horizontal plane, so somehow this way. And when the patient is looking in the down position in 30 degree Frankfurt's horizontal plane, we will ask the patient to move the mandible to right and left and move his head. That is how we record the posterior palatal seal. When we have placed the impression in the mouth and you are stabilizing it with your two fingers, you will ask the patient to perform Valsalva maneuver and not say again ah for recording the posterior palatal seal area. Just the Valsalva maneuver and 30 degree below looking your head and turning your head will record our posterior palatal seal. Next, coming to the mandibular border molding. So there are different techniques and different books which supposedly speaks about how we are supposed to do mandibular border molding. Some people prefer it to start from the labial section of the denture. Some people ask to start from the lingual. Some people say that retromolar pad should be recorded first. However matters which is comfortable to the particular clinician can go ahead with that. How to record each section, we will speak on that part first. So labial flange, as we all know that the mandibular labial frenum is the most active frenum among the maxillary and the mandibular. The mandibular frenum is the one which is more active, right, and maxillary is more passive. So what we are supposed to do is we will ask the patient to be seated calmly so that the tongue remains calm, and then we will ask the patient to move the lips, pucker the lip, open wide, grimace, smile, and all the activities by which the lower lip is moving. And if it is not moving properly, we have to pull it upward, inward when we are doing the border molding for the particular area for labial flange. Similarly, coming to the buccal flange area is the buccal frenum can be recorded unilaterally, where patient is asked to again pucker and smile, and also we will be taking it upward, inward, and frontward when we are doing the movement for the buccal flange area. So as said, the cheek is lifted outward, upward, and inward, and move forward and backward when we are doing the buccal flange area. Coming to distobuccal area again. Now the distobuccal area for the mandibular denture creating is the again the glitch about this particular area is this is a primary stress bearing area. We all know that's also called the buccal shelf area, correct? So how to record that particular area? So when we have to record this area, what we are supposed to do is stand in front of the patient. You will ask the patient to close the mouth forcefully while you are pressing the denture downward. So you are giving a downward press and the patient is taking it, trying to close. So basically there is an against force which is acting on each other. That's how that particular area is being recorded, correct? So that's also called the masseteric notch area. So what happens, the buccinator muscle that gives a notch in that particular area, so this cheek is pulled buccally to ensure it is engaged in the tray and then moved upward and outward. So what we are talking about the masseteric notch. So what we will do is we will ask the patient to close against the hand of the chin. So we are pressing it down and patient is trying to close. So basically a negative or a opposite vector of force which is acting, and hence we record this masseteric notch area. Coming to the retromolar pad. So how do we record the retromolar pad? Same thing, we will place the material onto the retromolar pad and then press the retromolar pad area with high pressure, and we'll ask the patient to open and close while doing the recording of the retromolar pad area. After the buccal side is totally finished, now we will start with the lingual side of the movement for recording the denture. Now when we have to start the border molding for the lingual side, we need to divide it into 3 different parts, right? So the first anterior section is called the lingual crescent area, then we have the mylohyoid ridge area, and then we have the post mylohyoid region. So now, which is also known as the lateral throat form area for the mandible anatomic landmarks, correct? So now first, how to record the lingual crescent area. So are we supposed to ask the patient to move the tongue as much as possible? No, not required. So what we are supposed to do is ask the patient to take the tongue till the lip and then just rub the tongue over the upper lip and leave it off. That is how we are supposed to record the lingual crescent area, the anterior part of the lingual sulcus. Once the anterior part of the lingual sulcus recording is done, then we have to do for the middle part of the lingual flange area. The middle part of the lingual flange area is by asking the patient to touch the lip on either side of the cheek from intraorally. So when we have to record the left side, we need to ask the patient to touch the tongue on the right side cheek, and when we are recording the right side, we have to ask the patient to do it on the left side cheek. So this is how we have to record the middle portion for the retromolar pad, record the middle portion of the alveolingual sulcus area. Coming to the final portion of the alveolingual sulcus area, or we also call it as lateral throat form, which typically gives a S shape. Now how is that S shape formed? Basically what happens is we have the muscles over there of the tongue, which is more powerful than the masseter muscle which is over there, right? So what happens when the tongue hits that particular area with the green stick, when you have put the green stick and you're manipulating it, so basically the denture also will get a hit of the tongue, which is more stronger muscle than the genioglossus muscle, that what we are talking about. So superior constrictor muscle which is passing from there and the genioglossus both will have a force on each other, but then the tongue muscle, the genioglossus, is more powerful than our superior constrictor. So what happens in return? The push of the muscle of the tongue will create the S shape typical when we are recording the lateral throat form. How are we supposed to do that? Just place the material there, ask the patient to do a swallowing movement, and ask the patient to open the mouth wide and close the mouth. That's all. We are recording the lateral throat form area, or we will get the typical S shape of the final part of your alveolingual sulcus, correct? So what, see, patient is distolingual flange. How we are doing? Perform bilaterally. Active patient is asked to protrude the tongue and then place the tongue in the distal part of the palate or upper part of the lip, and patient is also asked to close and open the mouth. So this is how the recording of the buccal shelf of the lateral throat form area is done. Now, there are different other methods that we do when we have spoken about the different types of border molding. That is the time when we spoke about there are 2 types of border molding, one which can be incremental border molding, one which can be single step border molding. Till now what we have studied or been looking forward was about the incremental border molding technique. Coming to the single step border molding technique, what we are supposed to do is take the special tray, apply the tray adhesive to that, and then in all you have to place your putty material or polyether, and then do all those movements simultaneously which are to be done in case of a incremental technique. The only difference remains is the material setting time or the working time for us is little more than that of a green stick. So you can manipulate, and in case you are not able to manipulate the entire incremental technique and you want some modification, there are BP blade. You can cut it off through BP blade and then remake that particular section, and it will get merged with your previous border molded area. So the excess can be removed and it can be filled easily when we are clarifying the things. Now what are the things that you need to verify in your border molding? So the border should be rounded, shining except the posterior palatal seal area, correct? Posterior parietal seal area should be matted. It should not have a shiny appearance. If the borders of the tray shows, it indicates under extension again. So you need to trim the tray and then reload the material and do the border molding. If the tray protrudes through the material, it indicates overextension. Basically build up little more tray and then do the border molding in that particular area. So this is how we are gonna achieve the border molding, which is a very crucial step while fabrication of your denture. After the border molding is done with this, what is the next step that we are supposed to do is remove out all the wax spacers and relief that you have given, okay, with the relief holes that you have made. All those things have to be removed, and then what we are supposed to do, apply the wash impression or the secondary impression. The different technique or the material that are choice for secondary impressions are, either you can use zinc oxide eugenol paste, which is also called the wash impression. That is because only 0.5 mm of your thickness is available onto the ZOE impression. More than that, it will be brittle and it will fracture, or it will not be of any use for other master cast to be provided. Another material of choice is light body silicone impression material. That is also an impression material for choice for secondary impression technique. So once all the movements are done, you have to make vent holes in the special tray, and after the vent holes are made, then you have to apply the secondary impression material, again load it, and then remake all the impression movements of the border molding that we did for regaining the thickness of the secondary impression material that we have provided, and that in toto will be considered as the border molding and secondary impression technique. So once that is in our hand, we need to check all the borders are properly recorded, all the freedoms are recorded, all the notches are recorded, and once that is all recorded, you need to go ahead with beading and boxing and then make a master cast out of it for the next clinical procedure that is there. That's all for today for this topic. Thank you.